Lung Cancer Awareness Month, and for good reason. Every year, more people die from lung cancer than colon, breast, and prostate cancers combined. You probably didn't realize that. Here to talk to us more about the disease is Dr. J. Tyler Van Backer. He's a thoracic surgeon with Hartford Healthcare at the Cancer Institute at the Hospital of Central Connecticut and Midstate Medical Center. Thanks so much for being with us, Doctor.
Thank you very much for having me, Kara.
Of course, we know smokers, but really, who's at risk for lung cancer?
Yeah, absolutely. So traditionally, notoriously, it's been smokers who've been at the forefront of the risk for lung cancer. However, about 10 to 20% of lung cancers are actually diagnosed in non-smokers. Secondhand exposure, secondhand smoke exposure, asbestos, and radon gas are some of the other exposures from the environment that can also increase your risk for lung cancer.
And what are the symptoms that are associated with lung cancer?
Well, unfortunately, most lung cancers are actually asymptomatic, meaning they don't have symptoms until they're a fairly late stage. Some of the earlier symptoms that patients may experience include weight loss, uncontrolled cough, and as the disease progresses, patients can experience chest pain and shortness of breath and other symptoms like that. And I should say, if patients are, anyone is experiencing symptoms like this, it's important to be evaluated by your doctor or primary care provider.
And some new technology at the Hospital of Central Connecticut is actually helping to diagnose it earlier than ever before. How does that work?
Yeah, it's excellent new technology that we have in the region. It's called the Auris Monarch, and it's a robotic bronchoscopy system. So it's a really fancy way of saying that traditionally we had nodules that we couldn't diagnose at a very small size because we couldn't access them or they were too difficult to find. Now we have almost like a GPS coordinate type of system where the Monarch uses a CAT scan and it allows us to see which airway to follow and allows us to view the path to find the nodules so we can get out to more nodules on the outside of the lung and smaller ones so we can diagnose them earlier. And when we're able to diagnose the lung cancers earlier, we can lead to treatment earlier, which leads to better outcomes for patients.
Yeah, thank you, doctor. Thanks for the information. And for those watching at home, you can get more information by visiting hartfordhealthcare.org/lung.